So you guys, here I am in the doctor's office, about to get surgery on my leg for varicose veins. This video is slightly different. It's actually about me having a surgical procedure. A couple reasons why I wanted to film it. One, I'm just interested in it, and in particular, I think you may be interested in it too. Just some of the advances in, conventional surgery. As you know, amongst this channel, yes, I take a particular interest in natural remedies, but I also incorporate many of the conventional options as well. And I'm pretty quick to say, guide you towards, I feel there's a safer, easier, better solution that's conventionally. I'll encourage you to go that way as well too. So it's a combination of both, and in many ways I think of it as, how can we get the best result for your dog, for your cat, and ultimately even for ourselves. So this is a newer surgical procedure. I had a condition called varicose veins, which isn't uncommon. It's probably genetic primarily. My mom had much the same thing, these big bulgy veins. But she was a nurse, but at the time the only real option surgery-wise was a pretty invasive surgery, which meant general anesthesia, these big incisions in your legs, these surgeons essentially going in, inserting a wire up the vein, and then it's called stripping, when they'd actually pull one end of the wire and actually pull that whole vein out. And as you can imagine, it could go the entire length of your rear leg, that whole inside of your leg. So as you can imagine, a whole lot of inflammation, swelling, pain. It wasn't uncommon for people to be painful for weeks after all the swelling because you've caused so much damage. Whereas now we're being able to do a couple things differently. Here I am having a very non-invasive in-office procedure, so a small amount of local anesthesia, and then secondary, what's happening in terms of what you're needing to do is essentially close off those vessels, those veins that are no longer actually doing anything. They're just passively pooling blood, so they're just sticking out. Secondarily, I'm getting it because I also have some swelling in my calf. It's called secondary edema or swelling in relation to these veins not doing what they're supposed to be doing anymore. So there's a couple reasons why I'm getting it, and then being able to then show you a pretty non-invasive way to treat it. And what they're doing, I introduced the video talking about a ligation. It's actually a chemical ligation. So instead of physically going in and tying the off with sutures, the physician is actually injecting in a chemical agent which causes those vessels to instantly react and then squeeze right down. And think of it as sort of like a chemical cautery that's closing them right off. So you may or may not be interested in it. I was interested in it. It was happening to me, and I think you might find it somewhat interesting to have a watch and see what's happening. So there's these bulgy veins there. And so the surgical procedure, as I understand it, involves using an ultrasound guided anesthesia injections, or injecting a local anesthesia. And what's happening is we're actually, he's going to go in and ligate or tie off the saphenous vein. So this big vein that's no longer doing what it's supposed to be doing. Hence all that, and the valves are no longer active. So what's happening is these valves collapse, and hence the blood just pools at the bottom of my leg. And that's what you're left with. This is Dr. Dave. He's going to be doing surgery on me. Wish me luck.
Okay. Let's see your big honking saphenous right there. So that's going to take a lot of sclerosant to close that baby. We don't want to spasm it so much that we can't get the actual sclerosant in that we're using. Okay, and here we go with the sclerosant. And we'll just turn everything white. Now we can follow that right back. And I want to trap it at the junction here, so we're not going to see too much right there right now. Okay, so we've got a pre-spasm. Now we've done Good spasm there. I'm going to use saline now just to flush this line.
So here I am post-surgery, actually feeling pretty good. Surprising, it was very uneventful, not painful at all. I just felt a few small little pricks, so what that meant was injecting in the local anesthesia, and then secondarily there's a thing called a sclerosing agent. So what that was is the actual chemical that causes the veins to constrict and deal with the varicose veins. But as you can see now, look what I'm left with. Oh my god. Yes, this crazy leg bandage that goes all the way up. I gotta wear that for 3 days. And there's a kid's soccer game today that I'm coaching. Oh, I can't wait for the comments. Thank you guys for watching this edition of Dr. Jones's surgery on getting on himself. I hope you found it interesting. What I want you to do now is a couple things. First, click up there to subscribe to my channel. And then next, go ahead, click that link in the box below. And then when you do that and you sign up for my newsletter, I can send you my free books and my free videos on how to heal your pets at home with my top natural remedies.